Long-term colorectal cancer incidence and mortality after lower endoscopy. What is this study? The third most common cancer in males and females. The number of deaths has increased over the last 15 years due to better screening and early detection of polyps and cancer, improved treatment, and more effective options. There is currently 1 million survivors in the U.S., 4.5-year survival rate with early detection over 90%, if cancer met 5-year survival lower than 10%.
Connects the stomach and small intestine to the anus. Colon cancer is a cancerous growth that occurs in the lining of this colon. It is an extremely common problem worldwide, with over 1 million new cases of colon cancer diagnosed annually. It is thought that both environmental factors.
About the risk factors. It is a bit to explain the risk factors like diet, smoking, and genetic.
Such as diet and smoking, as well as genetic factors play an important role in the development of colon cancer. The diagnosis of colon cancer often involves colonoscopy, an examination of the colon using an instrument called colonoscope that enables an evaluation of the inner lining of the colon. If necessary, a biopsy or sampling of cancer tissue can be performed during the examination.
Study population. The nurses health study, which included 170,000 U.S. female nurses 30 to 55 years of age at enrollment in 1976. Health professional follow-up study, which included in the U.S. male health professional for 40 to 75 years of age at enrollment in 1986. Statistical analysis. Participants who had base-limited history of cancer except for non-melanoma skin cancer, ulcerative colitis, colorectal polyps, familial polypopsy syndromes, or previous lower endoscopy were excluded. Assessment of lower endoscopy and polypectomy. A questionnaire administered every 2 years. Participants were asked whether they had undergone either single endoscopy or colonoscopy, and if so, the reasons for the investigation.
Once the diagnosis of colon cancer is made, the stage of cancer is initially assessed using a radiologic examination called CAT scan. It helps determine the size, location, and the spread of the cancer. Routine blood tests, including complete blood count, liver function tests, and a tumor marker called CEA, as well as chest X-ray, are obtained during the initial evaluation. There are 4 stages of colon cancer.
The results among 1,802 participants with a combined total of 15 incident cases of colorectal cancer in 7,014 men and non-women during 22 years of follow-up. We estimated that the population attributable risk of colorectal cancer, the proportion of the incident cancer that would have been prevented with colonoscopy, was 40% of colorectal cancer, 22% for proximal colon cancers, and 31% for distal colorectal cancer. Mortality after screening endoscopy. During follow-up, we identified a total of 4,074 deaths attributable to colorectal cancer. We observed lower mortality from colorectal cancer among participants who had undergone screening sigmoidoscopy and among those who had undergone screening colonoscopy. Without discussion, long-term incidence of colorectal cancer was lower among men and women who had a history of negative sigmoidoscopy, sedative colonoscopy, or polyectomy for adenoma than among those who had no history of endoscopy.
Colon cancer is defined as stage 1 if the cancer tissue is confined to the lining
Screening sigmoidoscopy and screening colonoscopy were associated with lower mortality from colorectal cancer, as compared with no-endoscopy, although only screening colonoscopy was associated with lower mortality from proximal colon cancer. Medical conclusions. The negative colonoscopy was associated with a significantly reduced incidence of distal colorectal cancer or proximal colon cancer up to 15 years after the procedure. 2. The 10 years of examination interval recommended by existing guidelines for persons at average risk who had a negative colonoscopy. Even a single negative colonoscopy is associated with a very low long-term risk of colorectal cancer. More frequently interval for persons with a family history of colorectal cancer, and then the participants with a history of adenoma will serve a reduced incidence of cancer up to 5 years after colonoscopy.